Tuesday night, close to 100 dental care professionals packed the Channel Marker restaurant in Atlantic Beach for their monthly Carteret County Dental Study Club meeting. Guests were Carteret County Sheriff Asa Buck and prescription drug diversion detective Chip Coble, who led a discussion about opioid addiction and the importance for prescribers to use the controlled substance reporting system. Dr. Bert Pearce of Pearce Periodontics, other dentists, dental hygienists, dental assistants, and office managers were among the professionals in attendance.
This is just something that kind of, I think, went beyond just dentistry. I mean, it's things that are related to our patients, but it's kind of the whole population and really the things that I think we can do to help, not just our patients, but the whole Carteret County, population in terms of controlled substances. And I don't think I realized the association that Sheriff Buck was talking between controlled substances and heroin use. I think that was something that was really surprising to me. So I think that the topic spoke to a lot of people, and I think that's why we had such a great turnout tonight.
I think the biggest thing we were trying to get across to everyone tonight, certainly talking about the prescription drug issue, as a whole, but speaking to our prescribers in the dental practice, letting them know that they are often the target for drug seekers. Another aspect to consider, in addition to trying to stamp out doctor shopping, we also encourage prescribers to check the controlled substance reporting system because of patient health and safety. If a patient is going to see one prescriber, they may have a prescription for a benzodiazepine for anxiety. And then if they go and see another doctor, and then that doctor may seek to prescribe them some sort of opioid painkiller. That is information that the opioid prescribing physician should know.
Dr. Pearce shares his thoughts on the CSRS and how this valuable clinical tool has benefited his practice and overall patient care.
You may be surprised with some patients that you maybe had a few suspicions about or you weren't suspicious of at all, and maybe asked for a few Vicodin here or there. And I've noticed a couple like that. I look up and they are getting larger amounts from, maybe other, not dental offices necessarily, but other medical offices. So sometimes you will be surprised, what you find out with your patients. And I don't think all these patients they may not all be abusing it, but at least it makes us more aware these are patients we should be careful about, that maybe there is some abuse potential with those people. But I think once people see how user-friendly it is, it can be pretty advantageous.
It gives a dentist a better picture, a fuller picture of a patient's history. Another thing, you do have the ones that seek to game the system, to get medications that should not have it, that are dependent, that are abusing the system for an illicit use, to take them themselves for the high. That gives the dentist the ability to look at that and maybe refer them to some treatment. If it's a good patient, a lot of these patients in doctor shoppings have no criminal records, they're mothers and fathers, they may even hold a steady job, but they have a dependency issue and they're taking more of a medication that they're given, and they're seeking more to fill a gap that they need to fill, and they're using the dentist to do that. It gives a dentist a first line of defense to maybe confronting somebody with a controlled substance issue and them getting help early on.